your head, Raul. Get on board. Time now 7:41. So good to be with you on this Tuesday morning, the 26th day of July. Did you know 1 in 10 people suffers from ringing in their ears? Joining us this morning with more is Dr. Chaffoo. Good to talk to you, doctor.
Good to talk to you, Erica.
All right, let's talk about the main reason that so many people suffer from this ringing in their ears.
Well, the main reason that people have ringing in the ears, the medical term is tinnitus, is due to damage to the inner ear from prolonged or sudden loud noise exposure. The inner ear is highly sensitive to any kind of long-term noise or very loud sudden noise. And so say if you've gone to a rock concert or you spent a long time working in a factory, you might notice ringing in the ears. In fact, we notice 10% or almost 30 million people in the United States suffer at some point from ringing in their ears. About a third of these have it for 15 years or more. Many of these people say it's a constant source of anxiety and worry.
And I've heard we could be making the problem worse with those earbuds that we all listen to music with, talk on the phone with.
Exactly.
It could be doing a lot of damage. Let's talk about some of the treatments.
So the big thing is there are different treatments available. There's something called cognitive behavioral therapy, which is biofeedback that your family doctor can refer you to an otolaryngologist and ear, nose, and throat specialist. Highly effective. There are some other treatments. You know, tinnitus bothers people, especially at night when it's quite quiet, when you're trying to sleep and there's no background noise. In that situation, there are noise blanking devices. You can put the radio on very low or put it between stations called white noise. The big thing is tinnitus, Erica, is a sign that there's an injury gone to your ear. And also, other things that can make tinnitus worse are things like caffeine, tobacco, and aspirin. So certainly, if you have this as a problem, you want to get in to see your family doctor for early treatment. There can be some other causes, tumors, infections, some other things can be signaling tinnitus. So it may be more a sign of a more underlying medical problem.
All right, let's talk about taking selfies. Do selfies cause wrinkles? Go.
Well, the short answer is we don't really know. The science is not quite there, but what some dermatologists have found, Erica, is that people that are taking selfies repeatedly may be exposing themselves to that high intensity light, that low level light that's the background for either blue or indigo in the spectrum. And what happens is that that light may cause some premature aging because that light may irritate the skin, may cause sun damage, may cause changes in the pigment of the skin. The other thing is that, you know, we tend to squint looking at our phones repeatedly, and that's because the font size is so small. That tends to cause more wrinkles around the eyes and you know, between the eyebrows and the forehead. So the third thing is that we do know that low-level light therapy can cause elevated levels of cortisol. Now, cortisol is a hormone responsible for in the stress level. So what happens is if you get in bed at night and you turn your cell phone on, as many people do, and you're on that for a long period of time, your cortisol levels will actually go up, and that interferes with one's ability to fall asleep or sleep at night. So we're probably not getting enough sleep if we're on those cell phones or tablets at night. So it's a combination of factors that's responsible for that premature aging related to cell phones.
So what are we talking about here? Like 20 selfies a day, 1 selfie a day?
Yeah, I mean these were people that were doing blogs. They were doing 50 selfies a day.
A day?
A day. So
Heads up, Jolla.
That's a lot.
There are people who take 50 selfies a day?
I know, hard to believe, right? But and
that's shocking. I'm sorry, I just had to take that in for a second. Okay, so the best way to prevent this is what?
Is don't do so many selfies. Certainly don't stay on your cell phone late at night. It can interfere with your sleep, and you're going to squint with the smaller font size on your phone. So go under settings and change that font size to get it larger, or like with me, you know, wear your little reading glasses to look at things so you're less likely to squint.
Wow, Dr. Chaffoo, this is enlightening. Thank you. We appreciate having you on, as always. Nobody rocks a black V-neck shirt like you do, Dr. Chaffoo. Well done.
Thank you.
Take care.
We are now learning new numbers regarding the destructive sand fire that continues to burn this morning just north of Los Angeles.
KTLA's Narissa Knight is near that massive wildfire and has been following the latest developments. Good morning to you.
Good morning, Erica and Raul. You know what the problem is around here? This right here, dense, dry brush that has not burned in 75 years, and it's giving our firefighters a hard time. Let's take